Subvocalization. Subvocalization is the use of the vocal apparatus in some way, whilst you are reading, mouthing the words either silently or audibly. Vocalization. It slows you down, unnecessarily. We have established that anyone learning to read English starts by saying the words out loud. Vocalization. Perhaps you stood up in class to read out loud to teacher. The other students followed what you were saying, probably pointing to the words with their fingers, mouthing the words audibly to themselves. Then, in turn, someone else stood up and read out loud. And you followed them, mouthing the words to yourself and pointing at the words. When teacher asked everyone to read quietly to themselves for a while, the lips, tongues and larynges were all still used, subvocalization, as if their owners were still reading out loud. Subvocalization was beneficial at that stage of reading. It helped you to sound out, and become familiar, with the words. But if you still subvocalize as you read, and many adults do, then it follows that you cannot read faster than you talk. And that is not enough. Females tend to talk faster than males, not a sexist remark. Listen to a group of people chatting informally, and check for yourself. Teenage girls are generally better and faster readers than teenage boys. There is no doubt that subvocalization plays a large part in this disparity. But male or female, very few people can talk, for a sustained period, at more than 4 words a second. Anyone who subvocalizes must be a slow reader, probably at a rate very much less than 240 words per minute, WPM. Being aware of the problem is a big part of the cure. Put a pencil between your lips and hold your voice box gently between finger and thumb, then read to yourself for a while. Any movement of the pencil, or in your throat, will soon be apparent. Just tell yourself to stop. If the problem seems persistent, some of the course exercises should help to cure you of the habit. Do not confuse physical subvocalization with that little mental thinking voice which may be talking to you somewhere in the back of your head. We will deal with that later.